Okay, so again, in humans, posterior and dorsal, anterior and ventral, they are synonymous. And then, okay, this is the other tough thing about these images. They're actually kind of flip-flop. So if you're studying off these images in Martini, kind of pay attention where your anterior and posterior is. Sometimes Martini switches it around. Actually, it's generally good in no matter what you're studying from. If OpenStack switches it around, you should also be aware where you are. Are you looking, in this case, we're looking at the front here, but the front is actually facing away from us in this image over here. But what am I getting at here? Again, typically you have your sensory neurons. They have their nuclei dorsally, and they're typically running toward the dorsal side. And then you have the ventral side that typically has motor neurons. So whenever you have a dorsal root and a ventral root, and you fuse them together, notice that they end up fusing together at the same peripheral nerve. So what we have here is a spinal nerve. So this is a spinal cord, but you have sensory neurons and you have motor neurons, and they end up fusing to form a common cord called the spinal nerve. So leads me to talk about mixed nerves. So mixed nerves means that they are both afferent and efferent. So they're both sensory and motor. They both detect things and carry out commands. So what we have here is that, and I think the C1 believe in Martini, it says that the C1 is pretty much not really, doesn't really have sensory neurons. Then people did studies and they found out small amounts of sensory input in C1, the C1 nerve. But for this class, just know that the C1 is predominantly motor nerves. It does have some sensory, but it's mostly motor. But the rest of the peripheral nerves and spinal nerves, they're mixed. They both sense things and carry out commands. And then let's talk about the spinal cord. So now we're at the bottom of the spinal cord, and then there's actually this part that tapers off. It's called the conus medullaris. So it looks like a cone. It kind of tapers off. It starts off wide, and it comes down very skinny. That's why it's called a conus. And the thing is that the main spinal cord, so it's not all the way here. It's not a big, thick all the way down here toward the coccyx. It actually tapers off right here. So it actually starts at the vertebra in newborns. It actually starts off lower, but as the person grows and the vertebrae become thicker, the spinal cord doesn't catch up with that growth. So what actually happens is that spinal cord, the growth of the vertebrae, actually outpaced the growth of the spinal cord. So it looks like it's moving up, but it's just like the vertebrae are overtaking the spinal cord in the growth. That's why it kind of moves up in adults, so to speak. So actually, in adults, this conus medullaris actually ends about the around vertebra L1. So it's actually not all the way down here to your coccyx. Okay, then we have something called the cauda equina. So cauda, if you remember like things like cranial versus caudal, cranial refers to the skull and head, and caudal refers to tail. So it refers to some sort of tail. Well, if you know someone who's into equestrian sports, what kind of animal does that involve? Well, actually, let's ask the chat. I mean, it's been a while since I asked the question. When someone does an equestrian sport, what type of sport or what does it involve? Hey, someone got the right answer already. Yes, so equestrian sports involve horses. So this is what it means. So the thing is like, yeah, I think there's different events. I'm not an expert. Yeah, so it involves horses. So equina refers to horse. So what we have here is horse plus tail. So cauda equina literally means horse's tail in Latin. So this is why I like to think of it. This is what it looks like actually in a cadaver. So I think to think of it, it looks kind of like a ponytail, a horse's tail. Or maybe if you didn't wash your ponytail, it might look like that. But yeah, that's what the cauda equina is all these nerve fibers running down like a horse's tail or a ponytail. And then it ends in something in the phylum terminale. So terminal, just like axon terminal, when you have a terminal, it's the end of something. So whenever you have a filament, it's like a thread, right? So it's like saying it ends in a thread. It's the ending thread or ending filament. So these are what your spinal cord ends with. Conus medullaris, where it goes from thick to thin. Then you have this ponytail right here, and then a terminal thread, this terminal filament. Okay, so then let's talk about, so we did talk about the vertebral foramen, and we did talk about how your spinal cord runs through this. But remember, you have those intervertebral foramina, and the thing is that each vertebrae has half of one, or roughly half of one. So now we have these foramen that, you notice that they're on the side. So these are how these spinal cords are actually able to branch off from the spinal cord. They go through these intervertebral, the spinal cord itself goes through this vertebral foramen, whereas these intervertebral foramen, these are where the branches, these spinal nerves run to the left and right. Okay, let's go back to Top Hat. And I'm not trying to trick you with this one, but just type in a response. How many months are in a year? Okay, let's see. The response is yes. Okay, good. I'm glad to know that everyone knows there's 12 months in a year. And okay, this one's a little, I mean, you should still know this, but among all the months, what is the maximum amount of days that you can have in any month? And you might be like, why is he asking things like this? Well, again, usually when I ask wacky questions like this, I'm building up to something, right? Okay, let's see the responses. So again, maximum amount of days in any given month, 31. So yeah, because remember, Halloween, what day is that? October 31st, right? Okay, so why did I bring up this kind of wacky trivia? Well, thing is that how are cranial and spinal nerves like a calendar? Well, the thing is that this is why I asked those questions. How many months are in a year? 12, right? How many cranial nerves are there? There are 12 cranial nerves, or actually 12 pairs of cranial nerves. What's the maximum amount of days in a month? 31, right? So how many pairs of spinal nerves do we have? We have 31 pairs. So that's why I like to say the peripheral nervous system is like a calendar. 12 pairs of cranial nerves and 31 pairs of spinal nerves. Now, let's talk about the spinal nerves. So notice that there are 8, 12, 5, 5. So we have 8 pairs. But remember our mnemonic with the vertebrae? Like how many vertebrae do we have in the cervical area? So remember we have 7 cervical vertebrae, 12 thoracic, and 5 lumbar vertebrae. So what we have here is like this mnemonic no longer works. So breakfast at 7, and then lunch at 12, dinner at 5. Well, now breakfast, we woke up a little late. Now it's at 8. But why do we have 8 cervical spinal nerves and only 7 cervical vertebrae? So why this difference? Why this extra? Well, the thing is that, okay, I'm showing you very cartoony right here. So here we have our T1 vertebra right down here. And let's stack the rest of the vertebrae. Let's stack the rest of the C1 through C7 vertebrae, and then add that skull on the top. Now the thing is that, remember those intervertebral foramina? So these spinal nerves actually run between each vertebrae. So what we have here, we have 7 so far, but remember we have our skull sitting on top of our C1, on our atlas, right? So the funny thing is that there's actually a spinal nerve that actually runs from between the skull and the C1. So count them. 1, 2, 3, 4, 5, 6, 7, 8. So this is where that extra, so to speak, spinal nerve comes from. It comes from the top of that between the C1 and the skull right here. So this is why there are 8 cervical vertebrae. I'm not 8 cervical spinal nerves, and only 7 cervical vertebrae.